So we've got a patient with prostatitis, trochlitis, and arteritis on their plate. What do you think it could be, guys?
Well, based on the symptoms you mentioned, I believe our patient is suffering from...
Hold up. Hold up. I don't see how those symptoms add up to that diagnosis.
And frankly, Doc Hawks, I couldn't agree more with Randall. Prostatitis and trochlitis are not usually indicators of Worth syndrome.
No. You're all wrong. This is a clear case of Worth syndrome right here.
More like worthless syndrome. Why do we have to go through this again? Do we not trust your diagnostic skills, Doc Hawks?
We don't doubt your abilities, Leslie. We just think you might be missing something.
I'd say it's worth giving some thought.
All right. Listen up, folks. I know what I'm talking about. Now, let me remind you all that we're performing a cysterothrectomy on this patient. We need to do it, and we need to do it now.
But Hawks, isn't the cysterothrectomy risky?
And does this patient really need it, considering their symptoms?
I just don't see how...
Fine. Let me put it this way. I don't give a damn about what's right or wrong. We're doing the cysterothrectomy.
And that's why you shouldn't be in charge of anything but yourself.
Yeah, maybe I should have just handed you that mop I was using for several months while I couldn't remember who the hell I was.
Hawks, I'm glad you're here because we need to discuss your recent proposal for a cysterothrectomy on one of your patients who you believe has Worth syndrome.
I'm not questioning my years of experience. This patient needs the procedure, and I've researched it thoroughly.
I understand that, Hawks, but we also need to consider your track record of being wrong in such cases. It's important to ensure we're making the best decision for our patients.
I appreciate your concern, Tracy, but this time I'm right. You should let me proceed with this surgery as per my plan.
Let's not dwell on past mistakes, Hawks. This is a new case, and it's crucial we make an informed decision based on current evidence and expert opinions.
I don't think you're understanding the situation correctly, Tracy. I'm not lying about this patient having Worth syndrome. The symptoms are all there, and the need for surgery couldn't be more apparent.
Frank, I must tell you that our patient is in critical condition. The surgery did not go as planned.
I know, and it's all because of Hawks's insistence on using cysterothrectomy for Worth syndrome patients. It was a grave mistake.
Indeed, it was a miscalculation on his part. Now, we have to find an alternative treatment that can help our patient recover.
I've been doing some research, and I believe the answer might be found in... well, something with surgery and drugs combined.
What are you suggesting, Frank? You know how much I hate your reckless ideas. We need a scientific approach to this.
I know, Randall, but sometimes we have to think outside the box. Anyway, I was thinking about something like... surgicoid, maybe.
I already hate asking, but what does surgicoid mean to you?
It's a new treatment idea. We use targeted radiation therapy in combination with some specific drugs. I'm pretty sure there are studies somewhere showing this has worked for cases like these.
Nah.
Bozos, I've had enough of your incompetence for one day.
We're sorry, Dr. Hawks.
We thought we were making the right call with the cysterothrectomy, but it seems there was a mistake with our diagnosis.
We'll make sure to be more careful in the future.
Careful. You nearly killed him. Worth syndrome is not some kind of joke. How did you make the patient go from worth to worthless real fast?
You're not only stealing bad ideas from a random number generator on your phone, you're now stealing bad jokes from me.
We're just trying to figure out what's going on here. What do you think the diagnosis might be?
We thought it was worth a shot with cysterothrectomy, but maybe there's something else we should look into.
Look into my ass.
What?
You heard me.
We would, Hawks, but there's a massive blockage in the shape of your head in the way.
So, how are things going in oncology?
Oh, pretty good, actually. We're seeing some promising results with a new treatment protocol we've been testing.
That's great to hear. I'm glad the patients are responding positively. We should try it on my doctors sometime. They remind me of some of your glioblastoma patients.
That's not funny, Hawks. My patients can accomplish more than your doctors can at that stage.
Exactly. Although I must admit, my mind is currently preoccupied with something else.
Oh, what's going on?
I've been trying to figure out a particularly puzzling medical case that's been brought in recently. And the more I think about it, the less clear things seem to become.
Well, you know what they say, a problem shared is a problem halved.
True enough. Maybe discussing this with you will help me shed some light on it.
Of course, that's what friends are for. Let's talk about your case. What's the situation?
Well, it's a young patient who has been experiencing unexplained weight loss and fatigue.
That doesn't sound good at all. What have you ruled out so far?
The initial tests showed no signs of an underlying disease or infection.
And what about her diet? Has she been eating healthy and getting the necessary nutrients?
That's exactly what I was thinking. After a thorough review, it seems that her symptoms are consistent with malnutrition.
Well, there you go. It's always the simple things we overlook.
I was lying. It's not that simple. Stop prying into my cases.
What's your problem? Are you using again?
I'm not disclosing that. Worth syndrome was a mistake. I found the real cause behind these symptoms.
And what might that be?
We have a patient on the table here, Hawks.
He could die if we don't act quickly.
I apologize for my attire, but I've found it all. Juvenile nephronophthisis is...
The patient is 39 years old. Genius. What is the prognosis for this condition?
How long do they have left?
about a week, give or take.
Wow, these past 21 years have been the longest week, give or take, I've ever heard of.
Tell it to the patient, wise ass. This is a serious diagnosis.
Well, we'll tell them it's serious when they wake up and begin laughing at how absurd this one is. Are you trying any more Hawks?
What is that supposed to mean?
Maybe it's time to admit it. Randall is a better Dr. Hawks. He knows what he's doing.
Fuck all of you. Well, congratulations to me for admitting I was wrong about Worth syndrome. It turns out it was juvenile nephronophthisis all along.
You should be proud of yourself, Hawks. You managed to find the correct diagnosis after making a mistake in the first place. Actually, no, that diagnosis is really stupid, given the patient's age.
I don't want to hear it. They have juvenile nephronophthisis and they're gonna like it.
Did something happen in the operating theater?
No, nothing. Not gonna talk about it.
For what it's worth, as much as I think Randall is a good boss, you at least know how to navigate a case if you don't get it right the first time.
That's not even a compliment, Tracy. Don't give me that. Good night.